Good evening, ladies and gentlemen. This is Dr. William Khieu. I'm coming to you from OrioMan. I usually practice in integrative medicine, but also have focus in bowel and urinary issues and problems. And during the pandemic, I'm coming to you to discuss about the important issue of how to deal with those kind of symptoms effectively with less medication, less procedure. First and foremost, I think it's really important to understand what started the symptom in the first place. So what are the symptoms we're talking about? Usually for ladies, for example, you hear about the frequency, the urgency. You have to get up 3, 4, 5 times a night. You never get any rest at home. And during the day, you just become a walking zombie. You're just not having enough sleep. Well, that by itself is a problem. Of course, if you're out there and active, you're trying to go for a walk, then you have leakage of urine, and as a result of that, some of you are told that you can just wear like a pad or diapers, and the next thing you know, there's a lot of other issues, hygienic problem associated with that. Did you know that the diaper industry is a $2 or $3 billion industry? So people are trying to sell more of these, but technically speaking, you really try to use those as little as possible and have a way to deal with them effectively. GI symptom or gastrointestinal symptom is equally of a problem. How often you have certain kind of food that you eat, or when you're hungry and you feel like your intestine making all sorts of noises in there. Well, that's an issue all by itself. That is just a symptom, the tip of the iceberg, what's going on inside your GI tract. And I think understanding all of that and the reasons behind it will give you better ability to control that with your doctors and be able to have the best version of yourself. So let's just start with why. Why are you having urinary symptom? Typically, most ladies, when you get older, especially you already have 2 or 3 or 4 children, your pelvic floor is actually sagging. So normally your pelvic floor is like this, and then when you're younger, and even though you have a cesarean section and didn't have a vaginal birth, carrying the baby for 9 months and the bag of water and the weight associated with that stretches everything out. So when that pelvic floor kind of sagging a little bit, that becomes a problem. So when it's sagging and there's more pressure on the bladder, then it's like having a water balloon that actually has someone's constantly squeezing on it, and then you feel the pressure, even though you just went to the bathroom a few hours ago. So understanding that and study about it will help take the pressure off the bladder and reduces the sensation that you have to go voiding all the time. Number 2, when the pelvic support is like this and urethra, when you void from, is right there. When it's sagging and sitting on top of the pelvic support, it's not a problem. But when you get too much sagging or you have a tearing in that muscle, it falls below, then it doesn't matter what you do, you try to squeeze really hard, but you're unable to control the stream of urine coming out. So that is an important part as well to help to reduce the possibility for that. Having a little bit proactive approach is going to help to minimize the symptom and hopefully to the point that you don't need to have extra procedures or surgery, or even if you did have procedure and surgery, it's going to make it last longer and that you don't need to have additional procedures and surgery. So I think that's the first part. We'll touch on the gastrointestinal symptom on the second part of this talk. But going back to the urinary symptoms, so what do? I think the first thing first is to make sure your bladder is relatively empty all the time. If your bladder is halfway full all the time, well, it doesn't matter what you do. Again, just like that water balloon we talked about, and that will always be full. When it's always full, the minute you lay down, go to bed, it actually pushes against the rest of the bladder, stimulate the nerve that tell you, well, you gotta go. And then you go to the restroom. Except your bladder is somewhat lazy, you only void 3/4 of your bladder, so there's still some urine in there. Again, you lay down, the next few hours, the bladder gets stretched out again with some existing urine in there, then you feel that you have to go again. And then up you go every single 3, 4, 5 times a night, and you never get enough rest at home at night. So that's really important to understand. So first, when you're actually voiding, it's extremely important to practice the technique to empty out your bladder completely. So just imagine your bladder is like a bucket of water. So instead of just getting up from the toilet quickly, just kind of slowly get up and tilt your pelvic right here, tilted. That way then you empty every single drop of urine every single time you go void. So when you leave the restroom, you make sure your bladder is completely empty. Number two, you need to avoid certain kind of food that actually causes irritation on your bladder, that cause your bladder to spasm. And those are typical things like caffeine, citrus food, and the number one offender is carbohydrate or sugar. When you have too much carbohydrate or sugar, next thing you know, it causes a lot of inflammation in the lining of your bladder, and that causes the bladder already kind of tense up, and that becomes an issue. During the day, you might not feel as much because you're active, you run around, and you actually burn off some of that carbohydrate that you ingest. However, at night, especially after dinner, and you were moving around a lot, so what happened to all of that sugar? A lot of that sugar circle around your body and get digested, but a fair amount of that actually circle back into your urinary and your bladder symptom because you need to excrete them. That sugar actually causes more inflammation, more spasm. That's the reason why when you have diabetic patient, and some of you might be diabetic, your doctors always check your urine for sugar in it, right? That's where it is. So if that sugar already flooding your urine, guess what's going to do to the lining of your bladder? Causes to be more inflamed, more spasm, and that becomes a problem. So once you actually change your diet routine a little bit, I think that would be extremely helpful. And the other part just mentioned is that make sure you empty your bladder completely. Number three, is really important for you to practice your bladder muscle. Remember, we talked about the pelvic support right here, the urethra right here. So if we strengthen this muscle to make it stronger every single time, then all of a sudden you can do better. So it's really simple. Each time you go void, sit right there in the toilet after you empty your bladder completely. Stay right there, don't go anywhere, and squeeze, let go 5 times, every single time after you void. So if you go void 10 times in a day, you already did 50 squeezes right there. In addition, whether you walking around, got driven somewhere, go somewhere, you see the red light just is a signal for you to do 5 additional squeezes. No one needs to know about it, but that's what you wanted to do. Red light, 5 squeezes. So if you come across 5 red lights during the course of a day, you do an additional 25 squeezes. If you do about 50 to 100 squeezes like that, called Kegel exercise, in a day, up to 40% of you will not need to have surgery, or you significantly improve. Number 2, once you get good at it, before you jump, before you cough, before you sneeze, you squeeze first, and that will help to reduce the amount of leaks you have. So once you actually do all of that, you're going to significantly improve. Then the second question is, well, what if you do all of that already and you still have these kind of symptoms? Well, that would be the time that you come to see a number of different physicians who actually practices in this field, including myself, to kind of see what else is going on. So what kind of study do we do? Usually 2 important studies. Number 1 is called cystometrogram, the study to look at the bladder function. We literally put a little catheter inside your bladder and fill it up and measure the pressure as that happens. So then we'll be able to see what happened to the pressure inside the bladder as it increases. At what point do you leak, and at what point your bladder starts spasm like crazy, and then that gives us a better idea as to how to treat you effectively. The second part is probably like a pelvic ultrasound. Make sure there's no cyst or mass or anything inside your pelvis that's actually pressing against it. Because it would be a shame to go to a doctor with all the urinary symptoms and then you have a cyst or mass inside your pelvic and pressing against it. And we just miss it altogether because we keep thinking about the bladder symptom and not talking about other organs in the pelvis that actually may cause associated symptom. And then number 3, a lot of doctors don't talk about this, but I think it's extremely important because a lot of us, as we get older, we gain some weight. Just imagine you gain 20, 30 pounds over the course of your life. And now, guess where that weights are? They're right here in your abdomen, inside your visceral fat. That's the problem. So if you carry an extra 20, 30 pounds, all that glob of fat literally sitting on top of your bladder. So remember, we talk about the bladder being like a water balloon. And if there's a big glob of fat sitting on there, you will have extra pressure on it. So just the fact that you have a healthier diet and lose 15 or 5 or 10 pounds, that would take the load off of the bladder significantly, and that would be extremely helpful. So those are the kind of simple tricks that will help to address the issue. Medication, I think, is reasonable, but I think it's important for everyone to ask their doctors, number one, why am I taking the medication? How long am I going to take the medication for? I think it is not a good idea in general to take medication forever, because all that does is that you can have too much of the medication itself, or the chemical associated with the byproduct of that medication circle around in your system, causes more inflammation and other unintended consequences. So it's always important to cover how long you're going to be taking it for, and what do you do in the meantime to mitigate the original symptoms itself. And then number three is surgery. Well, what if you need to have surgery? So if you do everything already right, you lost the weight and you have healthy diet and you avoid carbohydrate and all of that, you still need to have surgery, well, then that would be all right. That would be a vaginal surgery to lift everything up. So remember the pelvic support right here, the urethra right here that kind of falls below. So all we have to do is a relatively minor procedure, vaginally lift it up and then put the little support underneath in order to minimize the chance for it to going to fall down again. But even if you have surgery in the best of hands, you will get the improvement, but your job is to stay healthy so that that procedure is going to be lasting for many, many years to come. What do? Just what we talked about. Having a healthy diet, lost some of the weight to reduce the pressure load, have less of the irritating factors so that your bladder is not spasming all the time. And then all of that is going to ensure that your surgery is going to be lasting for a longer period of time, maybe forever, and you don't need to have any additional procedures done. At the end of the day, I think it's extremely important to know your body well. So as you kind of change from your diet routine and your exercise routine for your bladder health, it's important to see what works or what doesn't work. Because a lot of the things that I mentioned to you might work for your friend, but might not work for you. So therefore, try a different technique and see which one gives you the best results. And then do that some more. How do you know if something is working or not? Really simple. Give it 2 to 3 weeks of doing whatever that you try to do, whether you change your diet, exercise, and your eating habits, or your Kegel exercise that we talked about, because then you're going to do the things that actually give you the best result possible. All right, let's switch gear and talk about the GI, gastrointestinal health. I think that is the number one problem in America, because a lot of the time it all depends on the food that we eat and the kind of irritation we have in our GI system. When you don't have good absorption in your diet, then you have a lot of irritation factor inside. You probably hear a lot of news about people have all sorts of allergy to some sort of food, even though when they're younger they didn't have it. You hear about people that have IBS, irritated bowel syndrome. You probably hear about people that have other kind of inflammatory bowel problem. The reason why is that the health of your gut is actually out of control. Normally, we're supposed to have good, healthy bacteria inside your guts to digest your food. Except our diet has been changed drastically over the years. We have more packaged food, we have more processed food, a lot of the chemicals in it, and a lot of the process actually took away the healthy component of the food. And so now your gut is actually seeing more unhealthy products. And when that happens, it becomes a problem. And then that's why you hear all these kind of weird sound all the time. So one simple example that you can tell if your gut is a problem or not, what I'd like you to do is, at some point next week, just eat some asparagus, simple asparagus, and see how it goes. And if you eat asparagus and then all of a sudden you feel all the googly sound and then just kind of bloating sensation, gassy, that means that your gut flora, bacteria, is a little bit out of whack, a little bit. Because what happened is that for a healthy bowel, you should be able to digest it slowly and easily. But when you come across asparagus and some people broccoli, it becomes an issue. They just couldn't digest it well, so then all of a sudden become gassy and making noise and that kind of thing. Second part, when you're hungry, listen to your bowel. If you have an unhealthy bowel, then it's kind of moving and rushing and all of that. Why? Because the bad bacteria inside your gut get hungry. They're not being fed because, there's no extra carbohydrate and extra food source that come down. So they start to act up, making a lot of noise, a lot of gases, get your intestine going. That's when you feel this kind of terrible hunger, and that's the reason why. So when you know that, you need to kind of look into how to detox your GI system and how to improve on that. Then fast forward with that, when you have a bad intestinal tract, especially large intestine, then at some point in the future, you are unable to have a good, healthy ability to control the gas and the excretion itself. And so then a lot of these folks actually ended up having fecal incontinence or even gas incontinence. Often do people hear grandma and grandpa walking around and they're just passing gas and don't even pay attention or know about this. Well, that's not they don't know about it, it's that they know about it, but there was nothing they can do about it because the sphincter where the control processes over the years get weaker. Just like that pelvic support that we talked about, they get stretched out over the years. The sphincter, the anal sphincter also can get weaker and get relaxed over the years. So why do they get weaker? Before childbirth and everything else is associated with that. Also the weight gain, but also when you have too much of the, remember the GI in large intestine inflammation got irritated. Well, they just squeeze, a lot of pressure, tremendous pressure coming down. So when there's so much pressure there, eventually that anal sphincter become weaker and weaker, unable to have a better control because it works against much higher pressure over an extended period of time. So when that happens, it becomes a problem because the nerve that actually innervate the anal sphincter as well as other part of the pelvic support area is sacral nerve. Sacral nerve 2, 3, and 4 are usually the main nerves that actually innervate that. And just imagine you just keep firing stimulation at that nerve becomes so weak or insensitive to the signal, eventually it just kind of slightly open. And then you have gas incontinence to start, and then eventually some stool incontinence. Sometimes people get additional symptom. You heard about people get terrible sciatic pain, or people that actually pain even radiate down to the legs. Those are all associated with the same nerve. So what do you do about those scenarios? Besides having a healthy diet and a healthier GI system, what we do is that you can actually study to see, well, do you have these nerves sort of like a short circuit, they kind of misfiring. So when they're misfiring, the anal sphincter could spasm, and when they spasm, you don't have a real control over the stool or the gas anymore. So once you actually study the characteristic of that nerve, you can actually calm that nerves down. Again, besides having a healthier diet to reduces the chance of irritation, at times you can actually go to the nerve itself to tell the nerve to regulate the nerve, to synchronize that nerve, so then the signal become a lot more consistent. Regardless, if you don't take care of the source of the problem, the extra weight onto the bowel or the extra weight onto the bladder, or the chronic inflammation from the food source or medication that you take long term, then the problem is going to be partially solved only. What you need to do is, in addition to all of that, focus on the rest of your body and get yourself a healthier body by changing your diet routine, inflammatory markers, and all of that approach in order to maintain a healthier body. Then life become a lot more exciting and worth living instead of just sit there and having leakage in your urine and leakage in your stool and leakage in your gas, and then just someone else is going to have to come by and take care of you. All of that, as you know, become logistical nightmare for your loved one to take care of you, for the caretaker to take care of you, and the sense of dignity as well. So I think this video presentation is just in a way to kind of address what is really important to have a dignified, healthy lifestyle as you get older, and be able to be a little bit more proactive so that you won't have to go down the road that you might have seen other people that have experienced. Now, at the end of this conversation, I just want to entertain a few questions and answer about typical issues of problem people ask as to what else can be done about the pelvic support problem and then the bowel support problem, so that we can all learn from it from one another. Thank you. So, question number 1. I had vaginal mesh insertion years ago, or some of these laser vaginal rejuvenation surgery before. Do I need to do anything about it? Do I need to get the mesh removed? My answer is that if it ain't broke, don't fix it. So sure, there's a problem out there in the world when you hear about the time when vaginal mesh was being inserted. A lot of doctors put a lot of mesh into a lot of ladies. I was not one of those. I felt that the mesh is only necessary for very few subset of patients that actually has a significant vaginal prolapse. Unfortunately, the marketing team at the company actually went out there and marketed as if it is safe for anybody, including younger women. We're talking about people in their 40s and 50s and still very sexually active. That becomes an issue. Regardless, if it ain't broke, don't fix it. So therefore, if you had it done and you feel fine and you have no symptom and you feel normal, don't have any unusual discharge, bleeding, cramping, or pain, my recommendation, leave it alone, because it might be in the right place and has enough scar around it and it's working just fine. So there's no point in digging around making it worse. Now, if you have some symptoms, severe symptom, we're talking about severe urinary incontinence where you have leakage of urine or just have to have that sense of urgency all the time. Some people have severe pain all the time. Other people might have recurrent urinary tract infection multiple times in a month, for example. Those are people that need to get some sort of intervention. So the first intervention is, well, figure out what causes the problem. Find out why. And then once you determine the cause of the problem, then the solution becomes a little bit simpler. It could be the fact that there's so much scarring on the urethra. If that's the case, the answer is, well, urethral dilation would be the simplest approach. A gentle general anesthesia, dilate the urethra, and that'll stretch it out a little bit so it minimizes spasm effects of the urethra. Other people get severe scarring under the pelvic floor, and then you might need to go in there to clean out the scar to make sure that it will be more relaxed. It won't be like encroaching onto the pelvic support all the time. Sometimes you have so much of the scarring that you need to remove the entire mesh. But most of the time, you don't. And I think it's important to understand that. And just because some doctors go in and say they're going to remove the mesh for you, make sure you have an honest and clear conversation and the expectation. You don't need to remove every single piece of the mesh because the mesh is designed to become a part of your soft tissue and lay the scar in there. So if you try too aggressively to remove all the mesh, you might cause more damage because you go in there digging around, pull all of the mesh out. Well, what's left inside is like hamburger, whole bunch of soft, mushy tissue around. It's going to take a lot longer to heal, and chances are you're not going to be able to remove the entire mesh. So if the entire mesh are not easily removable, then leave it alone. Only remove the part or clean out the part that is necessary. I think it's extremely important. Now, sometimes, despite all the things that you do, and you still have these nagging symptom of urinary incontinence and urgency, then having one of those nerve regulation to calm down your nerve a little bit is helpful as well. So that's first question. Question number 2. I want to see my doctor and he or she said I need to have surgery. First, I am a surgeon by training, and what I'd like to tell everybody is extremely important that when you come to see any doctor, including surgeon, you don't want to hear the first word come out of that person's mouth is surgery. Because first you need to find out what is the cause of the problem, discover different ways to take care of them. Ideally, I would like everybody, including you, to have non-surgical approach, something that is minor, something that is least invasive, so that your body doesn't have to go through all of these complicated repair process and complications associated with that. Now, despite of all of those steps, and you did not get better, then I think surgery would be a reasonable option. So ideally, you want to hear something like, okay, this is the plan. This is your problem. We're going to try something simple. If that doesn't work in 2 months, 3 months, 6 months, something like that, and then we consider doing surgery. I think that would be a more reasonable approach. The point is, you want to be sure that you're not just having someone who just come in and all they do is just surgery all the time. I think surgery is a very good treatment modality for a number of different conditions, but I think it's important for all of us to be judicious about when to have that surgery. That's all. So I think it's extremely important to do your homework assignment, and it's absolutely reasonable to ask the questions all the time. Why you don't have surgery? When do you have surgery? What is the expected outcome? And what are the potential downfall? Once you understand all of that, you become a more informed patient. Then the timing and the procedure you're going to get is going to get a better result, because going into the procedure, you already get all of the information addressed. The last thing you want to do is have some of these expectations discussed with your doctors after the fact. I've been on these medications for a long time to relax my bladder. Do I need to take it forever, or what other options do I have? Well, it is a very good question. Again, the general philosophy is don't take anything forever, because then you're going to have to deal with the unintended consequences, the long-term exposure to certain kind of chemical and medication, or the byproduct of such chemical or medication. So therefore, when you start the medication, you ask the doctor, well, why am I taking this medication? How long do I take this medication for? And what is the plan to do in the meantime? So for those medications, the only thing it does is relax your bladder. So your bladder is a little more relaxed. You don't feel the urge to go void all the time. Therefore, you may have to go void only 2 or 3 times instead of 5, 6 times a night. So that's reasonable. So while you achieving that kind of relief, you need to modify your diet routine, your avoidance of certain kind of irritant. We talked about it before, like caffeine and citrus and carbohydrate, and losing some weight by having a healthier diet. Because once you achieve that, then you take less of the medication and see how is it going. Because chances are you might not need to take it forever. Even if you need to take something for a long time, you might need to take less of the dose, less medication, less side effects. And then also ask for any other treatment modality. For example, we talk about that nerve treatment to regulate the nerve activity. If you can get a treatment to tell the nerve to calm down a little bit and not get irritated all the time, not being stimulated all the time, that might be the other alternative as well. So I think overall it's important to have those kind of open dialogues, so then you'll be able to get the best treatment option possible with the least amount of medication and intervention as much as possible. Last question is, Dr. Khieu, you said I need to lose 15, 20 pounds. I've been doing this forever. The last like 30 years, I couldn't lose a single pound. What am I going to do? How about this? First, mindset. So I would say, okay, doesn't matter how old you are, you want to get a healthier body, you want to lighten up the load, you need to be sure you stay focused on that. And this is what I do with my patients all the time. So it's no jokes. Write on a piece of paper, I'm thankful I'm getting there to whatever the weight that you desire. So if you want to be 160 pounds, then write on the piece of paper, I'm thankful I'm getting to 160 every single day. Day and night, saying that in your brain, because you need to convince yourself first that you're going to be getting to 160. And then once it is clear in your mind, there's only one destination, when your weight is going to be, then the rest of the team, including your doctor, is going to be able to help you to get you there. So besides that, the next part is 3 simple steps that I think is going to be extremely helpful for you. So while you're doing that, I think a couple of things that you can just sort of get you the draining part. The number one problem in America is that sometimes we accidentally drinking too much caloric intake and sugar and that kind of thing. We drink too much and we don't even think about it. So that's why. So the simplest thing to do is drink only water, black coffee, or tea. Nothing in the water, nothing in the tea, nothing in the coffee. That way then you won't accidentally put extra creamers and sugar and sweetener and all that stuff in there, because all of that is going to cause us more inflammation, makes it much harder for you to lose weight. So water, black coffee, and tea only throughout the day, any time of the day. So that'd be the easy one. Number 2, you need to give your body a little break sometime. So don't have like snack all the time. In the olden day, when people working in the farm or in the field and didn't have electricity all the time, people don't just have snack at 9, 10, 11 o'clock at night. So it's important to kind of give your body a break. It's the way to let your body catch up with digesting some of the food that you had during the day. So my recommendation is whatever your dinner time is, 7, 8 o'clock at night, at that point going forward, no more food, no late night snack. and then don't eat again until 7, 8 in the morning, so 12 hours later. What that does is going to give your liver enough time to cleanse itself out. So any extra stuff that you ingest during the day, your liver gets a chance to clean it out instead of having constantly working all the time and not having enough time to cleanse itself out. So that's number 2. Number 3, when you start eating, the important thing is to focus on 2 main food groups. So instead of having all these complicated kind of food pyramid, you just eat 2 main food groups, and then the other stuff would be extra on top, so like icing on the cake. So what are the 2 main food groups? You eat the green vegetable stuff, including tomatoes and carrots, and then you eat the protein stuff. Could be plant protein, could be meat protein, could be egg protein, could be cheese protein, could be nuts protein, but protein stuff. And then if you have some extra rice or bread or potato, that's great. But less of that. So the main 2 food group on your plate would be the green stuff and the protein stuff. Make sure they're about the same. More green even better. If you just do those 3 things consistently for 3 months, most patients is going to significantly improve their diet, their health, and their weight. Why? Because you're not having extra caloric intake, extra carbohydrate float in your circulations all the time, and you give your body a little break all the time, every single day, to cleanse out any extra intake that you do. And I think that would be a very important first step. Once you've done that and you do it well and your mind is sharp and you're already focused on that, or during that time, come talk to some physician that is attuned to these kind of healthy living. And I think that person, that doctors will take you to the next level to get the healthier version of yourself. I think that's really what you are after, and that's what we would take pride in helping you to get to that level. Ladies and gentlemen, I would like to thank you for sharing this evening with me to discuss a very important topic that we just talked about. My goal is to share the information with all of you so that you can have a healthier body, healthier pelvic support, healthier gastrointestinal function, and healthier body in general. I think in medicine, we too often focus on the sickness. I would like you to, for a change, focus on the health, because the healthier you are, the less sick you're going to be. And then all of a sudden, you can enjoy your life a lot more. Thank you very much.